Which of the following is the primary goal of myocardial protection during cardiopulmonary bypass? A. To prevent blood clot formation. B. To prevent ischemic injury to the myocardium. C. To reduce heart rate. D. To enhance myocardial contractility. Answer: B. To prevent ischemic injury to the myocardium. Explanation: the primary goal of myocardial protection during cardiopulmonary bypass is to prevent ischemic injury to the myocardium. Ischemia can lead to cell death and myocardial dysfunction. Various methods, including cardioplegia, are employed to protect the heart from damage during surgery. What is the most common solution used for cardioplegia during cardiac surgery? A. Normal saline. B. Ringer's lactate solution. C. Blood-based solution. D. Potassium-rich solution. Answer: D. Potassium-rich solution. Explanation: potassium-rich solutions are commonly used in cardioplegia to arrest the heart by increasing the extracellular potassium concentration, which causes depolarization of the myocardial cells. This leads to the cessation of myocardial contraction and protects the heart from ischemic damage. Which of the following is the primary effect of hypothermic cardioplegia? A. Vasodilation. B. Myocardial contraction. C. Decreased metabolic demand of the myocardium. D. Increased coronary blood flow. Answer: C. Decreased metabolic demand of the myocardium. Explanation: hypothermic cardioplegia is used to reduce the metabolic demand of the myocardium. Cooling slows down cellular processes and decreases the need for oxygen, which helps protect the heart from ischemic injury during surgery. It also makes the myocardium more resistant to ischemia. Which of the following is a potential complication of prolonged use of cardioplegia during cardiac surgery? A. Myocardial infarction. B. Arrhythmias. C. Acute renal failure. D. Stroke. Answer: B. Arrhythmias. Explanation: prolonged use of cardioplegia can lead to arrhythmias after reperfusion of the heart. This is due to the disruption of ion gradients and the effects of ischemia reperfusion injury. Restoring normal myocardial function may also lead to electrical disturbances in the heart. Which of the following best describes blood cardioplegia? A. A solution containing a mixture of blood and saline for myocardial protection. B. A solution containing oxygenated blood for enhancing myocardial metabolism. C. A solution with potassium chloride to arrest the heart. D. A solution with magnesium to prevent arrhythmias. Answer: A. A solution containing a mixture of blood and saline for myocardial protection. Explanation: blood cardioplegia involves a mixture of blood with other components like saline and potassium. It is used to protect the myocardium by providing oxygenated blood and preventing ischemic injury. The solution is rich in potassium, which causes myocardial arrest, while the blood provides nutrients and oxygen to the heart during surgery. Which method of cardioplegia is characterized by intermittent infusion of a cold, potassium-rich solution directly into the coronary arteries? A. Antegrade cardioplegia. B. Retrograde cardioplegia. C. Cardioplegia via direct myocardial injection. D. Warm blood cardioplegia. Answer: A. Antegrade cardioplegia. Explanation: antegrade cardioplegia involves the infusion of a cold, potassium-rich solution directly into the coronary arteries, typically through the aortic root. This method is commonly used to arrest the heart during surgery. Retrograde cardioplegia, by contrast, delivers the solution through the coronary sinus. What is the main reason for using a combination of warm and cold cardioplegia during myocardial protection? A. To reduce postoperative swelling. B. To prevent early reperfusion injury. C. To restore the myocardial function quickly after surgery. D. To increase the duration of myocardial arrest. Answer: B. To prevent early reperfusion injury. Explanation: a combination of warm and cold cardioplegia can help minimize ischemia reperfusion injury by slowly warming the myocardium after a period of hypothermic arrest. This gradual rewarming can reduce the damage caused by sudden reperfusion and improve recovery of myocardial function. Which of the following is the primary mechanism by which cardioplegia protects the myocardium during cardiac surgery? A. Reduces coronary artery pressure. B. Arrests myocardial contraction and reduces metabolic demand. C. Increases myocardial blood flow. D. Stimulates the release of catecholamines. Answer: B. Arrests myocardial contraction and reduces metabolic demand. Explanation: Cardioplegia works primarily by arresting myocardial contraction, which significantly reduces the metabolic demand of the myocardium. By halting the heart's activity, cardioplegia allows the heart to survive the ischemic period during surgery while minimizing cellular injury. Which of the following is true regarding retrograde cardioplegia? A. It involves infusion through the aortic root. B. It delivers the cardioplegic solution via the coronary sinus. C. It uses a warm cardioplegic solution. D. It is typically used for non-coronary artery bypass surgeries. Answer: B. It delivers the cardioplegic solution via the coronary sinus. Explanation: Retrograde cardioplegia involves infusing the cardioplegic solution into the coronary sinus, which then distributes the solution through the venous system to the myocardium. This technique is commonly used when antegrade cardioplegia is not feasible. What is the effect of administering cold blood cardioplegia during cardiac surgery? A. It increases myocardial temperature to enhance enzyme function. B. It decreases myocardial metabolic rate and protects against ischemic injury. C. It improves myocardial contractility. D. It increases heart rate and oxygen demand. Answer: B. It decreases myocardial metabolic rate and protects against ischemic injury. Explanation: Cold blood cardioplegia lowers the temperature of the myocardium, which significantly reduces its metabolic demands and helps protect the heart from ischemic injury during the period of arrest. The cold temperature also slows down cellular processes, making the heart more resistant to damage during ischemia.